We're back here in the final segment of our program this evening, and we're enjoying the conversation with Dr. Duane Sands. And Dr. Sands, healthcare is extremely important to the Bahamian people, and you've been a leading surgeon in the Bahamas for a long time.
You know, that's how I got into this sordid business.
Yes.
Okay.
Sordid business of politics.
Of politics. And when you ask why is Duane Sands in the slightest bit interested in politics, I think you have to look at healthcare, because certainly the challenges of healthcare and the experience of healthcare for Bahamians is wanting.
But you know, you have some old timers who say that you are a gifted surgeon, and a gifted surgeon like Duane Sands should stay in the hospital, saving lives rather than running the government.
Mr. Jones, I have had the privilege of guiding and helping a number of young surgeons, male and female now, to do what I do. Now, not all of them are crazy enough or dumb enough to do all of the things that I do. Dr. Mark Weish, who is one of my colleagues, and I joke often, and Robin Roberts does the same thing, that there are very few young physicians who are prepared to be jack of all trades as we are. So vascular surgery, cardiac surgery, trauma surgery, endoscopy, no. They may do vascular, they may do cardiac, they may do thoracic, but they're not doing it all. That day is gone. Mm-hmm. But there are young, brilliant surgeons. And on Wednesday, a few days from now, after this show is recorded, there's a young lady who is headed off for an interview, hopefully to get a spot in a prestigious surgical training program, and I wish her well. The hope is that we continue to train young Bahamians to come back and take care of us, maybe you when you get old, because you seem to be an evergreen, and me when I get old, okay? So when I look up now, and I'm on that hospital gurney, I'd like to be able to take a deep breath and let it out and know that I'm in good hands. Mm. What we provide for ordinary Bahamians, in my view, is unacceptable. We have the juxtaposition of the most beautiful hotels, the most pristine water, financial services that are par excellence. And then we look at the type of care that we give to public patients. I've described it as medical apartheid. Yeah. And I think that we need to eliminate public-private medicine from the Bahamas. Just get rid of it.
How can you do that?
I think it's basically a matter of ensuring that the quality of care, not talking about creature comforts, that every Bahamian gets is at the same level. So the idea that somehow separate but equal exists in healthcare or education, I think is nonsense.
Well, in the Bahamas today, in many cases, when you do not have insurance, you die.
As we say, dog eat your lunch,
yes.
Okay?
Yes.
Now, that's not entirely true, because certainly in the public healthcare system, the professionals that are there and the institutions themselves do an unbelievable job with limited resources. But you cannot have a situation where people use $220 million worth of care and pay $7 million for it. It just cannot be sustained. And so what they see is that when they reach in the cupboard, there's not a particular drug or not a particular product that's needed to repair a broken bone or to patch a hole in the lung or what have you. That the number one cause of death of Bahamians, heart disease, cannot be treated in Princess Margaret Hospital.
Okay.
That's unacceptable in 2014 as far as I'm concerned.
And the fact of the matter is that if you do not have health insurance for those procedures that cannot be obtained at PMH, you die.
Well, that's not entirely true.
Because you are at the mercy of the Duane Sanses of this world who will determine whether or not they are going to treat you.
No. Duane Sands is obligated as a public physician to treat. Now, the question is whether or not, see, Duane Sands cannot operate on you at Princess Margaret Hospital for certain things. Sometimes you have to go into doctor's hospital to have access to certain equipment.
Right.
I put it to you
And
that
if you cannot afford doctor's
if
hospital,
we had a progressive
you die.
healthcare policy,
Yes.
then we would see that our preeminent healthcare facility should be right across the street right there called Princess Margaret Hospital. And that it would be the best facility for every single subset of medicine, whether that's neurology, internal medicine, surgery, cardiology, etc.
But you must be able to afford all of these things.
Absolutely.
Good.
And
the government now is saying that in order to afford these things, national health insurance must be introduced.
That is what they say, and you know, I don't want to get into this whole discussion again. All I say is,
and I know
that
you've
if we-
supported national health
and I
insurance
continue
in the
to
past.
support it, but I
Okay.
keep saying, let us do it right. Don't promise people what you cannot deliver. Do not promise people that when they go to get their MRI, that the machine, which hasn't been maintained because there's no money, or that there's no staff, or that the air conditioner went down and so the machine burnt up. You have to provide the same level of maintenance and support that any facility anywhere in the world that's comparable to what you are promising Bahamians exists in the public sector.
So that means that government should not be running a facility like PMH if you are going to introduce national health insurance.
I'm not convinced
Is
that
that what you're saying? Because
government doesn't do a good job of running anything.
my point,
So if we look at the airline, if we look at BEC,
right?
if we look at BTC, which is now supposedly private, but when it was all government, I don't think they did a particularly good job of running any of those agencies. And so while I don't think that the private sector left to its devices is the answer either, a public-private partnership or a private entity that is strictly and rigidly regulated by government seems to be the way to go. But what we need to do is to make sure that Mrs. Smith from Podolio Street, who is poor, who does not have money in her pocket to burn, is assured the same level and quality of health care as the CEO of a private corporation. Now, she may not get the same creature comforts as that individual, but the quality of care that she should get, the timeliness of the care that she gets should be no different. That's what I'm pushing for.
Right.
Now, if the CEO from that particular company wants a private room and a personal chef and a 60-inch flat screen TV and he can pay for it, or she can pay for it, fine. But there should be no difference at all in the outcomes measured year over year, diagnosis by diagnosis. So if Wendell Jones had a gallbladder removed and his complication rate was X, Susie Smith from Baintown or from Elizabeth or from Inagua, her complication rate should be the same, no different. We don't have that right now.
And how do we bring that about?
I suggest that as a country, that we engage in this discussion, that we ensure that it happens, and we benchmark it, and we make it happen. I am not convinced that it is going to happen when NHI is introduced, as the ministers say, in 2016, because they have now come up with a price tag of $500 million per year for NHI. I suggested it was going to be even more than that. And the true price tag they are unwilling to reveal. I put it to you, in an economy which is now flagging, that is existing at a $300 million per year deficit, that we're going to be hard pressed to meet the financial requirements for doing NHI properly.
Can any facility anywhere in the world handle all of the extraneous or the variables that would come before that institution.
No.
That's my point.
And so you have to pick a menu.
Yes.
You have to rigidly define what the benefits are, and you're going to say, we're going to agree that in the first instance, this is what we're going to provide. And if it's not on that menu, you are going to have to pay for it yourself.
Okay.
And when that person shows up now, when Wendell Jones shows up now and this thing is off the menu, don't call Perry Christie or don't call Perry Gomez and say, well, give that to Wendell because that's my boy.
Dr. Sands, it's wonderful speaking to you. We are out of time, and I wish we could go on for another hour. Thank you so very much.
It's been a real pleasure. Thank you so much for having me.
Yes. Come back to see us soon. And you always facilitate us, and I thank you so very much for coming here at very short notice. Thank you for watching and listening to our program this evening. Good evening, everyone.